Hello and welcome. Today we're diving deep into a rare, benign tumor affecting the urinary system, the bladder leiomyoma. We'll explore what it is, how it develops, and what treatment options are available. Let's get started. The exact cause of bladder leiomyomas remains largely unknown, making it a bit of a mystery. However, several factors are suspected to play a role. These include hormonal influences, particularly estrogen, genetic predispositions, and smooth muscle cell abnormalities within the bladder wall. While no single cause has been definitively identified, research continues to explore these potential contributors. Now let's talk pathophysiology, how this tumor actually forms. Bladder leiomyomas are benign tumors arising from the smooth muscle cells of the bladder wall, specifically the detrusor muscle. These cells begin to proliferate uncontrollably, forming a distinct mass. As the tumor grows, it can push into the bladder lumen, potentially obstructing urine flow. Its growth pattern and location determine the specific symptoms experienced by the patient. These tumors are typically slow growing, allowing them to reach a considerable size before causing noticeable issues. Bladder leiomyomas are considered rare tumors. Due to their infrequent occurrence, precise epidemiological data is limited. They appear more frequently in females than males, with a higher incidence observed in individuals between the ages of 30 and 50. However, they can occur in individuals of any age or sex. More comprehensive research is needed to determine the true prevalence of this rare condition. The signs and symptoms of a bladder leiomyoma can vary greatly depending on the tumor's size and location. Some individuals may experience no symptoms at all in the early stages. As the tumor grows, it can cause urinary frequency, urgency, and nocturia, the need to urinate frequently at night. Dysuria, or painful urination, is another possible symptom. In some cases, the tumor can obstruct the flow of urine, leading to urinary retention or even blood in the urine, known as hematuria. These symptoms can often mimic other urinary conditions, highlighting the importance of accurate diagnosis. Diagnosing a bladder leiomyoma typically involves a combination of imaging and endoscopic procedures. The process often begins with a thorough medical history and physical examination. Imaging techniques such as ultrasound, CT scans, and MRI can help visualize the tumor's size, location, and extent. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows for direct visualization of the tumor and enables a biopsy to be taken. The biopsy sample is then examined under a microscope to confirm the diagnosis and rule out malignancy. While bladder leiomomas don't have subtypes in the traditional sense, they can be broadly categorized based on their location within the bladder wall. They can be intramural, meaning within the muscle layer, submucosal, located beneath the bladder lining, or subserosal, found beneath the outer layer of the bladder. The specific location can influence the symptoms and the surgical approach used for removal. The treatment for bladder leiomyoma primarily focuses on symptom relief and tumor removal. Asymptomatic, small tumors may only require observation with regular monitoring. For symptomatic tumors, surgical removal is the most common approach. This can be performed through transurethral resection, where the tumor is removed through the urethra using specialized instruments. In some cases, open surgery or laparoscopic surgery may be necessary, particularly for larger tumors. The choice of surgical approach depends on the tumor's size, location, and the patient's overall health. Unfortunately, there are no known specific preventative measures for bladder leiomyomas due to their unknown etiology. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, is generally recommended for overall health, but won't specifically prevent these tumors. The prognosis for bladder leiomyoma is generally excellent. These tumors are benign and rarely recur after complete surgical removal. Regular follow-up appointments are recommended to monitor for any potential recurrence. Recent research focuses on understanding the molecular mechanisms driving leiomyoma development and identifying potential therapeutic targets. While significant advancements are still needed, ongoing research holds promise for improved treatment strategies in the future.